Hi, my guest today on the Ripple Effect Evolution is Dr. Navi Muradali. So, Dr. Muradali is a medical doctor with over 20 years' experience in the health and wellness program. He is the former medical director of the HealthNet clinics and served as the city medical officer of health in San Fernando. Dr. Muradali was also the youngest mayor of San Fernando, and he's now the CEO of Patient Connect, a digital health company in the Americas focusing on chat-based care programs for employees and residents of the Caribbean and Latin America. Dr. Muradali, it's definitely a pleasure to have you on the show.
Thank you very much, Deanne. Thank you very much to your team at the Ripple Effect.
The
It's nice to
Ripple
be
Effect
here.
Evolution. We are keep creating an evolution. We want to change up things to make it more positive. That's our aim.
And that's my aim as well. So I'm happy to be here.
So, I mean, you're always giving out tips on Facebook. So I've seen that you put something the other day about intermittent fasting. Tell us a little more about intermittent fasting and what are the benefits of it.
On my Facebook page, I normally put up some tips of, things that I would see in journals, things that I see based on evidence in a lot of the studies. So intermittent fasting has become popular in the last few years. It's also known as time restrictive eating.
Yeah, limited hours to eat.
Limited hours to eat. But, sometimes many people will just go and Google it and they'll come up with some wrong information about what time restricted eating is about intermittent fasting. So what I try to do on my Facebook page, when I'm treating my patients, I try to introduce intermittent fasting as one of the modalities in the management of things like diabetes, polycystic ovarian disease, overweight, obesity. So intermittent fasting is really, as the name implies, it's missing a meal, skipping a meal, sometimes, one meal a day.
Okay.
But how I utilize it in practice is really for the diabetic patients or the patients with polycystic ovarian. I would normally introduce a 16-8 intermittent fast.
16-8.
So 16 hours where your body's in a state of fast.
Yeah.
And 8 hours where there's a window where you can have your 2 meals. So in this case, the fast that I do...
Not eat for 8 whole hours, right?
Not eat for... And I normally have to emphasize that point, that you're not eating continuously for 8 hours.
Right.
That 8 hours is a window.
Correct.
Where you can have lunch and you can have dinner. So I would normally recommend to patients, they can skip the breakfast. Now,
so we change breakfast is no longer the most important meal of the day.
Well, in the Western world, with the chronic disease epidemic, lifestyle diseases being rampant, diabetes, you find that a lot of the research that has gone into it shows that by skipping the breakfast, you can keep your insulin levels low and therefore your sugar levels low.
Right.
So I'll give you one example. The American Diabetes Association, for example, they talk a lot about reversal of diabetes.
That is something that could happen.
That's something that could happen.
Okay.
So years ago, you could, if you were to ask a doctor, even, now, I guess in medical school, they will say, no, there's no cure for diabetes.
Correct.
And that's probably true. There's no cure per se, but we can reverse it to the point where we may not necessarily need the type of medication that we were taking before. And it certainly improves all of the biomarkers of disease in the body. So to come back to the point about intermittent fasting. So what I've seen over the past 5 years, doing it with my patients who are diabetic, I've found that, some of them, they start doing the skipping breakfast.
Yeah.
They have their lunch, they have their dinner. Now that has to go hand in hand with reducing the amount of carbohydrates that you're taking in.
Okay.
Right? So
when you're eating, you're actually eating less carbs.
Less carbs.
Okay.
So they call it a low carbohydrate diet or a low carb diet. So again, coming back to the studies, so intermittent fasting, low carbohydrate diet, and the exercise, those 3 things have been found to reduce your A1C, which is, diabetics every 3 months have to do this test called A1C.
Yeah.
And that A1C gives you a kind of idea of how well the diabetes is being controlled.
So diabetes affects all the organs in your body.
All the organs in your body.
Your circulation. So it is definitely something you want to correct before you even go into it that diabetes is something so bad that you want to reverse it if you are there and you don't want to be dependent on medicine. So you're saying that this diet has been proven to start to reverse diabetes.
Correct. So, as I said, it's part of the modalities. It's not the only thing you have to do.
Okay.
It is low carbohydrate diet,
Yes.
exercise, the persons who will be on medication. Now, certainly when you start the intermittent fast, over a period of time, when the A1C starts to come down, you have to consult your physician and
Less medicine.
and decide if the medication, the dosage, or even if you need medication.
At all.
Because many of the patients, you find about 50% of medications, patients over maybe a 6-month, 1-year period are off their medication.
Correct.
Right? Now, there's some tips that I normally put on my Facebook page as well. If you are doing the intermittent fast, to add something like MCT oil in the morning. And people always ask, what is this MCT oil?
But isn't oil fatty?
Yes, the MCT oil is a fat, but remember we're talking about a condition where we're trying to keep our insulin levels low. And if you have a choice between fat, protein, and sugar,
but it's one of the good fats,
you find that the MCT oil does not spike the insulin levels as high as sugar would do. For example, for people who are having cereal in the morning,
correct,
or a fruit bowl, that's going to spike your insulin levels.
Fruits are really too much sugar.
Correct. So when you have a lot of that in the morning, you're going to spike your insulin. However, if you're doing the intermittent fast, I normally recommend you use a teaspoon of the MCT oil, which happens to be a derivative of coconut oil.
Coconut oil, correct.
And it's medium chain. So that means it
and
has...
we do need it. We do need it. Because I think people think sometimes you're going to diet, you don't need fats at all.
No. And that is one of the big misconceptions over the years, where we tell everyone low fat. And we have continued to use that incorrectly to tell people no fat. Your body needs fat.
Correct.
It needs the healthy fats.
Yes.
And we have not made a distinction between healthy and unhealthy fats.
Okay.
I can give you an example. Vegetable oils. Recently, there's so many papers showing that things like canola, soybean, those are very inflammatory to the body. Those are fats. Those are oils.
Bad for you, yes.
So what about if we use something now like seafood, the fatty fish? You know, like salmon. That's a healthy fat.
Yes.
MCT oil is a healthy fat.
Olive oil is also one of the good oils.
Extra virgin olive oil, one of my favorite oils, because if you look at the Mediterranean diet, you will see that it stars in the Mediterranean diet.
And they say they have the lowest, the highest incidence of centurion people living to be 100 plus.
Correct. So when you look at the evidence now, population-wise, countries where people are living longer and healthier, not just longer, but healthier.
Quality of life.
They're not getting diabetes, as in the Caribbean, you're getting diabetes at 30s, 40s, and 50s.
Correct.
If they were to get diabetes, it's late into their 70s, 80s, if at all.
And quality of life is so important as you get older.
Correct. So when you look at what they're doing, they're using a lot of extra virgin olive oil. So why are we not using the extra virgin olive oil? Are we trying to now use the inflammatory oils? So that's one good point that you raised there about that. But the MCT oil, you can use it in your tea or coffee. Right. So I normally...
And these oils should not be cooked. That's very important to note.
Correct. So the MCT oil should not be cooking.
As well.
Yeah, but the MCT oil, you should not be cooking with the MCT oil. It's really to just put into
a beverage or something.
Into your tea or your coffee,
salad.
or maybe an almond milk in the morning, unsweetened almond milk. You know?
Okay.
So when you add that fat, what does that MCT do for you? Your brain is about 80% fat. And one of the things from an evolutionary standpoint is that our brain, our heart, our body needs this healthy fat.
The healthy fat, right.
And by using the MCT oil, it was shown to have many, many benefits in the morning. Our energy levels go up. Our cravings decrease. We don't feel hungry as much. So those are the benefits.
But they also claim that your mood is enhanced, your memories improve, you start to lose weight.
I see from experience you're saying that. So that is one of the things that, I use MCT oil.
And it also gives you a very good clean out.
And that's another benefit.
Your frequencies improve. Yes.
Correct. So the benefits of MCT oil are numerous. Studies have shown that by giving it to patients with Alzheimer's disease, there were 2 groups, those with MCT oil and without MCT oil. They monitored them for a very long period of time. And the group that had cognitive improvement were using the MCT oil because there is
What space of time we talking about?
it was about 6 months to
6 months.
one year,
Okay.
and they found that the
Because I always
cognitive
expect results in
improvement.
2 weeks. Okay, so
Yeah, so most people expect results, but the good thing about it is that if you are diabetic and you're using the intermittent fasting, the low carbohydrate diet, exercise with the MCT oil in the morning, you can actually see a sizable reduction in the sugar levels.
quickly, because you do everything that you're supposed to do.
Correct. Because,
Okay.
I always ask the patients, does your body produce that much sugar to have your sugar reading at 400? And the
My
answer is
goodness.
no. The answer is that it has to come from outside. It's coming from outside.
Yeah.
You cannot have a sugar level of 300 and 400.
I don't think people realize that a lot of carbs turn into sugar, or that fruits turn into sugar.
Most people don't get the fact that by eating bread in the morning,
Bread, correct.
bread is equal to sugar. Rice is equal to sugar.
Fruits
Fruits is equal to sugar. Now, there's nothing wrong with having those things in moderation.
in moderation.
But
yeah, that's our basic diet, though.
and it's a cultural diet. It's
So
still relatively affordable.
So let's talk about that, because we always blame our parents and say, well, I inherited, there's a hereditary disease and thing. But isn't it really lifestyle choices? We probably learn how to eat from our parents. We learn that the flour and the potato and the this and the that, all that makes up one meal. Whereas we have the knowledge now and the ability to change it and realize that there's a healthier way.
And that's the issue there. You actually hit the nail on the head there. Because a lot of people like to blame genetics.
Correct.
When the reality is that it's lifestyle. It's
Lifestyle
what
choices.
we're eating, what we are drinking, how we're not sleeping properly, we're not exercising adequately, we have bad habits, alcohol, smoking. All of those are lifestyle. Now, we can't change the genes, we can't change our gender, right? But we could certainly change what we eat, what we put into the body.
And definitely what we drink.
And definitely what we drink. So the take-home message really is that if you are trying to live a healthier life, and we like to use data in this country conveniently.
I know.
They normally say that there are about maybe 200,000 diabetics in Trinidad, which is a sizable part of the population. But nobody ever says how many pre-diabetics we have.
I know.
How many people who are close to diabetes? There isn't a study for that. And in my estimation, looking at people who are overweight, obese, who may not have been diabetic yet, that number rises astronomically in terms of the number of people who have what we call insulin resistance, right? Now, I don't want to complicate you right now too much about insulin resistance, but the two main ideas behind it is one, when we have too much carbs, the insulin spikes.
It is a Western young thing, though. The plenty carbs, because when you go, a typical meal will have rice and provision and roti or some bread somewhere along the line.
Even if you go to religious functions,
Right.
all of our delicacies, it's a combination of flour, sugar, milk.
Correct.
Right?
All the things you shouldn't be indulging in.
Right.
Once in a while is not bad. You're not saying cut it out completely.
We're not saying that.
But that is your basic. That's our staples.
So the thing about it is, it's really the family pot concept that you were trying to allude to. Is the family pot we grew up with. So then everybody in the family now becomes obese or overweight or diabetic. And then they say, oh, that's genetic.
It's genetic.
It runs in the family.
And it's not.
From an evolutionary standpoint, again, genes take hundreds of thousands of years to change into a population disease.
So we are causing it ourselves.
So if you look at data from the 40s, 50s, and 60s, how many diabetics did we have? How many people had heart disease? So that cannot
People live longer,
that cannot be a genetic issue. That's a lifestyle issue. And the main culprit has really been the fact that we've adopted fast food. And I think a lot has been said about fast food. But one of the things that many people don't know and they don't relate to this whole epidemic is that in the 70s, the United States in the Midwest they realized that from corn, they could derive a sweetener They call it high fructose corn
Yes,
syrup.
which is not good for you.
And they use that in their pastries, their beverages, almost everything. You go to the grocery now, you will see high fructose corn syrup. In fact, they have about 100 and something names for it. They've changed the name, maltodextrin, cornstarch,
Right.
a lot of names to keep away from the word high fructose corn syrup. Regardless of that, that is why our exports of sugarcane decreased, because
The corn replaced it.
they were now producing their own sweetener in North America. They didn't really need our sugarcane anymore. So that started to happen in the 70s and 80s. And if you look at the population data about the incidence of diabetes, heart disease, things that we
Everything
never
went
even
up.
heard about, autoimmune diseases, cancers, all of those things started to rise in the 80s and 90s.
Because of
Now
the
we have
introduction of-
an epidemic proportion in the Caribbean, and nobody's talking about high fructose corn syrup as one of the main culprits. Because it's 90% in the groceries. You pick up anything, you pick up
Any
ketchup,
product, any
you
product.
pick up,
But is it addictive? Because sugar is addictive.
well, of course. And the thing about fructose, right? So let me make a distinction now. So fructose, which what we call fruit sugar, it comes from the corn and the mangoes, the bananas. So that's fruit sugar. The interesting thing about fructose is that fructose is not converted into energy in the body. Fructose is almost entirely metabolized by the liver and it turns into fat.
Okay.
You've heard about a fatty liver.
Okay, so I was going to talk about that too and ask you that question. So our diets gives almost everybody, because we do use a lot of oils, a lot of grease, a lot of carbs, give us a fatty liver disease, which is almost close to like when you drink too much alcohol.
So prior to
Is that what it does? And make it slow down your liver?
Prior to importation of all of these foods into the Caribbean, the number one cause for fatty liver was alcohol.
Okay.
Now, alcohol is the second cause for fatty liver. The number one cause is fructose.
Really?
The number one cause comes from our diet. So we need to look at fructose, because fructose is directly related. Now, it's very, very clear to fatty liver. And when you have a fatty liver, what does that mean? It means that we have this thing called organ fat. And it slows down the work of the liver.
Of the liver, correct.
What does the liver do?
All the elimination.
The liver has hundreds of functions.
Yeah.
And the main one is detoxification.
Yes.
It also produces cholesterol. So we also have a problem with high cholesterol in the Caribbean. And we attribute the high cholesterol, again, wrongfully, to maybe the oils. But what about the fact that the fructose, so the sugar that we're taking in, is being converted into fat in the liver, and that is causing the dysregulation of cholesterol, and that's what's sending the cholesterol up. So yes, many doctors will be using statins and other drugs to reduce it. But what about trying to cut the fructose in your diet as a start?
Right.
Do that. Do the intermittent fasting.
I'm not going to tell you that.
Low carbohydrate diet. Exercise.
So the same remedy for a fatty liver is the same you're saying for even the insulin resistance.
Correct. Because when you have that organ fat, that fatty liver, that is really the precursor to this thing called insulin resistance. The cells become resistant to the effects of insulin. Because we need insulin to take the sugar into the cell. When the cell becomes resistant to the effects of insulin, the sugar can't go into the cell. It raises your blood sugar.
Right.
So that's one of the main ideas behind fatty liver as a result of the excess fructose in our diet. But the other one is the fact that we are eating so many times a day, and it's high carbs.
So ideally, you think one meal a day is sufficient?
Well, I mean, in my practice, I would tell patients to have their lunch, have their dinner, right? Skip the breakfast, use the MCT oil in the morning with their tea or coffee, right?
That should give you enough fuel.
It will give you enough fuel to take you to lunch. You cut your carbs by 50% at lunchtime and cut your carbs 50% at dinner time.
What do you think about a water fast?
Well, the water fast is good. I mean, it helps, keep your insulin low. It does something by getting rid of the dead cells. It stimulates, those kind of processes.
But you shouldn't do it for too long.
But you have to be careful in doing it, because, I mean, if you're diabetic and your sugar goes too low now, you can end up in problems, especially if you're taking medication. Okay. So you definitely, you need to be very cautious. Somebody who's not diabetic, they could probably try the water fast. But it's something that, I mean, it has its benefits, but I tend to prefer having your lunch, having your dinner, but cutting your carbs by 50% in those meals. So I'm not
Or you're
saying
not saying
don't
cut
have,
it out, not a
cut out,
keto diet. You
this
just
is,
say
no, I'm not saying cut out all your rice or cut out all your flour, but I'm saying reduce it by
reduce.
50%. And then in 3 months, if you're diabetic, for example, look at your A1C. If you're pre-diabetic, look at it. See if there's a reduction. If you see the benefits, then you'll be motivated
Of
to
course.
cut more and more and more until you reach a low carb diet.
Understood.
So those are really the takeaways, like what I post on Facebook about intermittent fasting. There's a lot more. A lot of it goes deep into the science of it.
Of course, we just touch on the tip of the iceberg, and everything we're saying to you all is, of course, consult your doctor before you change your diet drastically, before you go in any program, and make sure that if you're on medicine, that's even more important than a healthy person trying something for the first time.
Correct. Definitely always be guided by a physician. If you are starting intermittent fasting, tell your doctor about it because you may have a reduction in the amount of medication
That you need, which is
So you
very
don't want the sugar
important.
to go
Yes.
too low.
Correct.
And certainly you don't want that to mess up because you may also be on other medications, things for like high blood pressure, cholesterol. So you definitely, if you're doing any changes to your diet, you need to consult your physician.
So, Dr. Muradali, thank you for being on the show. Do you have any last words you want to share with people, or even like a thought for the week until we have our next podcast? What would you like people to do? Something about health?
Yeah, well, one of the things that I always try to do is in promoting a healthy lifestyle, I think it's very, very important not to forget your mental health. And that's one of the things that we tend to miss. We're looking for all the physical things to do, but the anxiety and the depression and the stress, we're not dealing with those things. And we need people to not think, that because I have to go to see a psychologist,
Correct.
something is wrong with me.
No.
Because it's certainly something that we need to address.
I lived in Chile for a couple of years, and a woman sent her 3-year-old child to a psychologist because she was having a problem with her having a new baby, and he couldn't conceptualize a sibling. And I was fascinated because they send their children at 13, 14 for therapy. That's normal. And I was fascinated by that because I said, Trina, we're not there yet. We're
Correct.
definitely not there yet.
And one of the things, again, in this crime epidemic that we have, a lot of it is driven by mental health. And if we address it head on, you will actually see a reduction in crime when we address the mental health
and we
problems
have people saying they're shame to take their child for therapy, or they're shame to go for
There's
therapy,
no shame
and we
in
need to
that.
change that.
Absolutely. So thank you very much. I love the ripple effect. Thank you very much, Deanne. Thank you to your team.
And the ripple effect is also about your mental health. We talk about your physical health today, and we stay tuned for us to do a show on mental health. Thanks again, Doctor, for coming on the show.
Thank you very much.